Yesterday to 8 p.m. we had 919 cases of community transmission, and in addition to the very sad passing of the 30-year-old which was reported yesterday, there was one additional death of a man in his 80s.
With almost 1,000 new cases today, sometime overnight the outbreak that started back on June 16th will pass 15,000 cases. But if there's a silver lining, it's New South Wales' daily vaccination
We now
rate.
have 6.1 million jabs given in New South Wales, and nearly 1/3 of our population is fully vaccinated. It's hovering at 32-point-something%, which is great at this stage.
And the strongest foreshadowing yet that those who have had both of their shots will be rewarded soon.
We will have those extra freedoms, and we're looking forward as a team to announce tomorrow or the day after what life looks like in September for those who are fully vaccinated.
But while daily new case and vaccination numbers have been the key info in our daily pandemic updates so far, our leaders have made it clear that as vaccination numbers rise, we'll need to refocus.
The national plan then transfers our focus from case numbers to issues of hospitalisation, serious illness, ICU and things of that nature.
Right now in New South Wales, there are 844 staffed ICU beds available. Currently, 113 of those beds are already occupied by COVID cases.
There's no doubt that people would be alarmed with the rising case numbers, but it's again a mark of how well the vaccines work, that our hospitalisation rate is still relatively low.
So as New South Wales plans to start scaling back restrictions as soon as tomorrow, and Australia looks to start living with COVID, can the health system cope if cases skyrocket while millions remain unvaccinated?
Joined now by Dr Danielle McMullen, who's president of the AMA in New South Wales. Thanks very much for your time. Hospitalisations are fairly low, I suppose. We just heard Gladys Berejiklian say there. How much pressure would you say is on the frontline nurses and doctors in Sydney's ICUs right now?
They're under significant pressure, as is our whole health system, whether it's general practitioners trying to really take the best possible care of patients with their day-to-day non-COVID illnesses, the emergency department staff faced with patients where they don't know if they've got COVID or not, and then hospitals having to split into COVID and non-COVID care. And then, of course, that pointy end of it, the ICU doctors and nurses who are taking care of people in their most desperate time of need. At all points in that system, we're under enormous strain. Hospitals are full even without COVID. So, of course, every case of COVID that we're seeing puts more pressure on the system and takes away somewhat from our ability to look after non-COVID illness.
So how do you feel when you hear Gladys talk about opening up? What happens when we open up and you still have so many people unvaccinated?
The time is not yet. As a health organisation, we've been racking our brains and can't think of any settings where it would be safe to relax restrictions at this stage. We really need more time to get vaccination numbers up. Obviously, we have to reopen at some point, but we've had clear modelling that says that point is much closer to that 70 to 80% of double vaccinations. And at this time, we really need to keep staying the course, staying at home, and then getting vaccinated as soon as we can so that our health system can continue to be there for you when you need us most.
Well, currently around 15% of Sydney's ICU beds have COVID patients in them. At what point would capacity for patients with other conditions be compromised if those COVID numbers go up?
Well, it's a really tricky question, and it depends where those cases are, how many days we see them in a row, and how unwell those people get. We've obviously already taken some steps to reduce demand on intensive care units, so things like reducing elective surgery and the likelihood that people will need that sort of care after an operation. There are a number of settings in place to try and reduce load on the system, but all of those things mean there's people at home waiting for health care that they really do need now or need soon into the future. So as quickly as we can, we need to get back to delivering usual hospital care. And to do that, we need everyone in the community to play their part and follow these stay-at-home orders and obviously also get vaccinated.
So we're talking about like a fixed capacity of ICU beds, for example, but the federal government, Greg Hunt, the health minister, has been saying for a long time, we're ready, we have a plan, there's a whole surge capacity ready to go, we can turn this on, and that'll be really important, especially once we get through vaccination and we start the living with COVID phase. Do you know that plan? Like, is that what you're seeing on the ground, that we are ready to flick that switch?
So I would call it more of a gradual change than a switch. There is surge capacity that exists. We've seen that played out today at Westmead Hospital, where there have been diversions put in place. We're bringing in private hospitals to help, and we've seen it over the past few weeks with changes to elective surgery. But all of these things aren't long-term sustainable solutions. In the short term, we do need to avail ourselves of these workforce supports, as well as structural supports, extra wards that can be stood up, extra beds we can create. But we also need to then work as a community to develop those longer-term plans about how we operate a health system when we've got COVID in the community.
Danielle, thanks so much for your time.
Thanks.
With so much content online, it's sometimes hard to keep up with it all. And let's face it, who has the time? The Project YouTube has you covered with the stories that matter. Hit subscribe for a daily list of the news that you need to know.